Hi, I'm Lisa Fox from the National Center for Pyramid Model Innovations, funded by the Office of Special Ed Programs. And I'm here with my colleague, Kelly Tuomikoski, from the Michigan Multi-Tiered System of Supports Technical Assistance Center. So thank you so much for joining us for our brief presentation on expanding MTSS to preschool for positive social emotional outcomes. So in our brief time with you, thank you, I'll be sharing a little bit about the pyramid model for promoting social emotional competence in infants and young children and how it might be used in an early childhood program as an MTSS. Kelly will describe to you how they're doing it in Michigan, its alignment to their approach in the implementation of MTSS, and they'll really get into the details about their state installation activities. So let me talk about the pyramid model for just a couple of minutes. So it was developed almost 20 years ago to provide guidance to the field on evidence-based practices for promoting young children's social, emotional, and behavioral development and to address challenging behavior. So we had federal funding from the Office of Special Ed Programs, from childcare, these are all federally funded efforts, and from Head Start. And with that federal funding, a group of collaborators from multiple universities worked together to identify the practices. We used a public health framework when we thought about what are the practices. So we thought about what are the practices, what do we know for promoting all young children's social emotional development? What are the prevention practices, meaning the practices that would prevent children from having challenging behavior? What are the practices for ensuring that children who have social emotional delays get the intervention they need so that they can achieve their social emotional outcomes and not have problem behavior? And then how should programs and practitioners be ready to deliver effective intervention to children with persistent challenging behavior? So each practices we identified that's within that framework has an evidence base. And the complete framework, meaning the complete pyramid model, has actually been tested in 2 randomized studies and found efficacious in those preschool inclusive classrooms. The National Center for Pyramid Model Innovations, or NCPMI, is funded to help states and local programs implement the pyramid model as an MTSS with a goal for improving young children's social, emotional, and behavioral outcomes. So if you go to the next slide. So of course, the practices are important, but for the pyramid to work as an MTSS, you need more than evidence-based practices, right? The tiered interventions are the core, but we also need the systems features so that evidence-based practices can be implemented with fidelity, so that every child receives the instruction and intervention that they need to be successful. So in addition to implementing the pyramid practices with fidelity, we need to establish this infrastructure so that can happen. So I guess it's not in addition to, in order for pyramid model practices to be implemented with fidelity, we need a program-wide infrastructure to be able to make sure children get these interventions and teachers use these effective practices. So in this image, you see that a leadership team guides implementation. A leadership team is charged with securing and maintaining staff buy-in to the approach, to think about and promote family engagement for the families served by the program to understand the approach that's going to be used, and also to ensure that interventions are implemented in partnership with families. The leadership team guides a process for establishing program-wide expectations, and then teachers align their rules, their classroom rules, to those expectations. The leadership team thinks about the provision of professional development to teachers so that they have understanding and how to implement practices with fidelity and deliver interventions to children who need more. And that professional development also includes the provision of coaching. In our research and in our work, and I think across the field in general, we've all come to realize that when we implement complex practices, comprehensive interventions, the teachers need coaching to be able to do that with fidelity. And so coaching is really a core component of bringing this framework to a program. And then the leadership team uses data for their decision making, making decisions about the delivery of interventions to children, making decisions about ensuring that we're implementing this approach with fidelity. So as the developers of the pyramid model, we've developed some tools for teams to use for the data piece of an MTSS, and we guide programs in how to use their tools. For example, programs are using social emotional screening tools. So how do they use that in their MTSS implementation? And how to use their curriculum-based child outcome measures might be another tool that they have that comes to bear in their thinking about the delivery of intervention and the support of each and every child in the program. The tools we've developed that are specific to the pyramid model include measuring the fidelity in which program-wide implementation is in place. So that's our early childhood benchmarks of quality. So the leadership team uses that tool. Another tool we developed is a tool for measuring the teacher's fidelity of implementation of the pyramid model practices. So a tool that helps us understand the teacher's strengths and the teacher's needs for practice fidelity and for coaching. And then because we provide coaching, we want to make sure that we're providing coaching in the manner it's been designed and intended, and it will move practices. And so we use a practitioner coaching log, and leadership teams then can analyze those data to see if coaching is being delivered as intended and if teachers are making progress. We also designed a tool for programs to use to monitor child behavior incidents. So they have data on child behavior incidents and the adult responses to those incidents. And they can use those data to make decisions related to the support of children and to the support of teachers. This system, the behavior incident report system, allows for analysis at the child level, the teacher level, and at the program level, and helps that team understand the use of exclusionary discipline practices, including equity concerns, by calculating disproportionate use of certain practices. That's a little bit about how the pyramid model comes to a program to be used as an MTSS. Let me tell you just a tiny bit about what we do when we do statewide implementation and what those features are. So we began working with Michigan and are thrilled to continue to work with Michigan through our state technical assistance efforts. And when we come to a state to help them with statewide implementation and scale up of the pyramid model, we first start by helping them establish a state leadership team. That leadership team's cross-sector. So that means we want to have early childhood special ed, we want to have Head Start, we want to have childcare, we want to have public school people at the table. And the reason it's cross-sector is children with disabilities are in every system, they're everywhere. And so we want to have all of those players together, all of those people who have the capacity for making decisions about implementation and scale up, working together for that effort. We guide the team to establish a professional development network of program implementation coaches. That's kind of a mouthful. The idea there is you need professionals who will recruit programs, guide programs, train leadership teams, and kind of make that happen. Really the purveyors of this intervention to establish it and help it be implemented with fidelity. And then the next layer you see are our implementation and demonstration sites. Of course, in implementation sites where you start, we're getting MTSS implemented within a program. And we hope as they move towards fidelity that they can serve as a demonstration in the state to show what a high fidelity implementation looks like and what the data are and the outcomes are when you implement something like the pyramid model as an MTSS for young children. And of course, for each of these levels, kind of the foundation is that data use and data decision making. So in our work in a state, We bring our knowledge of implementation science and our data tools, and we guide the state and each level of implementation to use data in data decision making. So let's hear more from Kelly. She'll make this very real for you. And she'll really be able to unpack what this looks like in Michigan's approach to installation. Kelly.
Thank you, Lisa, for this opportunity to share Michigan's story. Again, I'm Kelly Tuomikoski. I work for Michigan's MTSS Technical Assistance Center. I'm the Model Demonstration and Research Projects Administrator. And I also co-lead the Early Childhood MTSS state team. So that would be the state leadership team that Lisa was just talking about on the previous graphic. And I also co-lead our Early Childhood PBIS implementation team. So I'll be able to talk in more detail about both of those as we go through today. So our Technical Assistance Center has historically supported an integrated model of MTSS in K-12 and has only in the past couple of years began to also support early childhood MTSS. We are so grateful for the partnership with the National Center for Pyramid Model Innovations to support us in this new learning. Our journey began through learning from a transformation zone. So back in 2016, the Michigan Department of Ed, in partnership with SISIP, developed a transformation zone to build an implementation infrastructure to support the effective use of MTSS. This figure depicts the transformation zone as the place to transition from what is, the left-hand side, to what is envisioned, the right-hand side. A number of lessons were learned from this transformation zone, including recognition of the need for a state-level team that was really focused on developing, maintaining, and improving technical assistance to support MTSS within early childhood settings. As a result of this transformation zone, conversations around early childhood MTSS began to occur across offices at the Michigan Department of Ed and within our own TA Center. As our reach expands beyond K-12, our TA Center continues to be guided by implementation science. We are big fans of NERN's implementation stages, such big fans, in fact, that here is our new director, Kim St. Martin, sporting her implementation stages t-shirt. So knowing how important those stages are and knowing how costly it can be to skip the exploration stage, leaders from the Michigan Department of Ed and our TA Center, including folks like Liz Newell and Steve Goodman, worked hard to foster relationships and cultivate champions for early childhood MTSS. Through a number of exploration stage activities focused on understanding the supports currently in place in Michigan and outside of Michigan, discussions began to focus in on the pyramid model. And a need was identified to seek out assistance from NCPMI. For those of you listening today who, like myself, have understood MTSS primarily through the K-12 lens, and you're less familiar with the pyramid model, it can be helpful to reflect upon the essential components of MTSS and see how program-wide implementation of the pyramid model maps onto those components. So on the left is Michigan's pinwheel graphic that outlines the essential components of MTSS as defined through Michigan's MTSS practice profile. On the right, I'll highlight a few of the connections I've drawn as I've learned more about program-wide pyramid model. When we study the pyramid model itself, as Lisa described, it focuses in on instruction, interventions, and supports within a tiered delivery system. Lisa also went into good detail about the leadership team. It is essential to implementation, and not just at the site, but across the cascade. A team-based leadership approach is imperative. Lisa also went into previously talking about the data tools involved for fidelity, progress monitoring, and outcomes that are part of a comprehensive screening and assessment system. And we know that with program-wide implementation, we utilize Look, Think, Act protocols. These are user-friendly guides from NCPMI that have been built around each data source and are differentiated across the cascade to support both implementers as well as local, regional, and state leadership teams to engage in continuous database decision-making. When you start seeing these connections between MTSS and program-wide pyramid model, it starts to make sense that a natural partnership with NCPMI would occur. MDE and the TA Center entered into this 2-year technical assistance partnership in November of 2020. And through this partnership, I'm excited to say that we have started to install a statewide infrastructure to support program-wide implementation of the pyramid model. I'm going to touch on just a few of the installation stage activities we've been engaged in over the past 2 years and highlight some of the lessons that we've learned through our partnership. One of the first activities listed here is really this need to go back and make sure what we're implementing is clearly defined and well understood. One of my first realizations as I entered into this work is that pyramid model practices have been implemented and supported in Michigan for a number of years. The practices themselves were not new, but the statewide infrastructure to support those practices needed some attention. As our early childhood MTSS state team began to work together, I realized that given Michigan's history of implementation, we were all entering the conversation together with different prior experience and background knowledge on what it meant when we said pyramid model. As a new learner myself, I was struggling to connect and translate and found myself needing to go back and more clearly define what it is that we mean when we say pyramid model. Lisa was tremendously helpful. We worked together on this graphic to support the early childhood MTSS state team, coalesce around some common vocabulary, and to draw distinctions between what are the pyramid model innovations and the infrastructure to support those innovations. So you see here the dark blue and light blue ovals indicate the 2 layers of infrastructure that are built to support the pyramid model innovations themselves. Both the community-wide and statewide infrastructure have leadership teams anchored to a specific set of benchmarks of quality to guide their work. The overlapping orange circle ovals represent the innovations themselves. Up until this point in the presentation, we've been talking really just about one of the innovations, program-wide pyramid model. But it's important to recognize that there really are 2 different but overlapping pyramid model innovations. Early intervention pyramid model focuses on supporting early interventionists to work with families of children birth to 3. And program-wide focuses on supporting classroom teaching teams to work with infants, toddlers, preschoolers, and their families. Lisa, is there anything else you would add here for those of us that are newer to the pyramid model?
No, I think you've captured the 2 innovations really well. I was really glad to engage in this to get it all on a picture, which is great.
Thanks, Lisa. So with a clearer understanding of the pyramid model innovations, we're better equipped as a state team to understand the resources and supports needed to implement those innovations, but true learning comes from doing. In the summer of 2021, we kicked off our early childhood PBIS model demonstration project to dive more deeply into understanding what it's needed to grow and sustain program-wide pyramid model. I'm so thankful to have had the opportunity to learn from our previous director, Steve Goodman. He helped frame my understanding on why we engage in model demonstrations and what we do with the learning that comes from these projects. A model demonstration seeks to answer a few critical questions. Does this practice work in a specific setting with a specific population? Can the impact of the practice be reproduced in different settings with different populations? And if so, how does the practice become embedded within existing MTSS implementation supports to increase the reach or scale to a critical mass of implementers across the state? While this graphic makes it seem like we're pretty far along in our journey, I can assure you we are not, but this does outline some of the very beginning stages of learning we've had through our model demonstration project. In our first year of implementing, which was this past school year, we began with a focus on recruiting state-funded pre-K classrooms. We started here for a couple reasons. First, one of the biggest champions for this work has been the manager of our state-funded pre-K program, Pat Sargent. And second, these programs already had positions established that were providing coaching to pre-K teaching teams, allowing us to leverage these positions to support practice-based coaching of the pyramid model practices. What we quickly realized is that given the nature of the mixed delivery system in early childhood, you can't go into an early childhood center or a school-based pre-K with the intent of a program-wide approach to pyramid model and then work just with the state-funded pre-K classrooms. That would be like implementing school-wide PBIS in just one wing of a school. So that meant that we needed to make sure that we were inclusive of all the preschool classrooms that were in the same shared space. So we worked quickly to include Head Start, tuition-based classrooms, early childhood special ed classrooms, to make sure that our initial implementation sites had all their classrooms on board to support a safe and consistent learning environment for all children in that space. That realization quickly changed the scope of our work. Within a month's time last summer, we pivoted to make sure that we had everybody signed up for the right trainings and that we had connected with our Head Start colleagues and we're headed in a good direction. Another piece of learning we've had along the way is given our TA Center's long history in supporting school-wide PBIS, we have been especially interested in studying the intersection of program-wide pyramid model with school-wide PBIS when the preschools are situated in elementary schools that are implementing PBIS. So we're excited to have 4 implementation sites right now that have this configuration so that we can learn with them about what makes sense in terms of teaming structures and consistent expectations for all children in the building. So that's really exciting learning for us. We also are learning a tremendous amount about the different entities that operate preschool programs. So right now we're focused on sites operated by local districts or their intermediate school districts, but we have our eye toward additional learning around community-based preschools as well. So lots of learning going on in a tight time frame. While our reach is pretty minimal at this point, we've managed to recruit implementation sites for this project from multiple regions of our state with a diversity of student populations that's allowed us to carefully study not just the overall impact of this project, but the differential impact as well. So I look forward to being able to share our results soon as we wrap up our first year of implementation. As we wrap up this presentation here, I'll share one final installation stage activity that we have engaged in throughout this past year, and that's the need to revisit our teaming structures. It takes time to figure out what needs to be discussed, by whom, and how often. One addition we've made here in Michigan to the statewide implementation infrastructure that Lisa was discussing is the inclusion of an implementation team. While our state leadership team has broad representation across offices within MDE and a broad focus on birth to 5, our implementation team right now is more narrowly focused on the model demonstration project of program-wide implementation of pyramid model in preschool settings. This implementation team includes TA Center staff who are the ones doing the actual professional learning and coaching to our implementation sites. And we also have representation from our evaluation and research unit to make sure that we are collecting the right data at the right times. Most importantly, our implementation team also includes representation from MDE. Our Michigan Department of Ed champions for this work are tremendously helpful. They attend our meetings, support us with barrier busting, support us with communication, ensure our work remains a priority for our stakeholder groups, and we're grateful for their contributions to this team. Before we sign off, I want to take a minute to acknowledge the long list of folks who have supported this journey. Thank you to each of you for your commitment to supporting early childhood MTSS in Michigan. Liz Newell, Steve Goodman, Pat Sargent, you have been early champions of this work and continue to support it. And our partners, Lisa, you and your colleagues at NCPMI have been so wonderfully helpful, and we have been grateful for your assistance. If you are interested in learning more, I'd encourage you to visit our Model Demonstration Project's webpage. On that page, you'll find a resource that defines model demonstrations in the context of MTSS. You'll also find a really nice brief overview video that one of our early childhood implementation specialists did, providing an overview of our model demo project. You're also more than welcome to reach out to me directly with questions. Thank you so much for your time. We've appreciated it.